The Ashanti region is witnessing a monumental transformation in healthcare infrastructure, a testament to the government's unparalleled commitment to improving the lives of citizens. At the heart of this transformation is the new 510-bed maternity block at the Komfo-Anokye Teaching Hospital, a state-of-the-art facility poised to revolutionize maternal and child health care.
Previously, it was quite bad in terms of, pregnant women used to wait sometimes on the corridors to have their turn to deliver. Fortunately, through the efforts of Mrs. Akufo-Addo, we had the Nana Fiakobi Sewa block. That is for mothers and then babies. Fantastic. But we still need to expand our space because we have certain services that at the moment do not have wards. So it's something that we look forward to because it's going to give us a lot of breathing space. And the fact that it's also going to come with very modern equipment that we'll put to use for the management of patients in this hospital.
The Komfo-Anokye Maternity and Child Block was started by former leader of this country, head of state, Ashanti, over 40 years ago. When I was a medical student in Komfo-Anokye, somewhere in 2005, 2004, 2005, this structure was standing. Many presidents came, saw it, and left quietly because it was a very mammoth, monolithic, elephantic structure. But it's not surprising. President Akufo-Addo is a very courageous leader. He runs to projects that people run away from. And so we sat down and realized that we needed about 140 million euros. And I am not surprised because there are packages where we use 70 million euros to build about 8-9 hospitals, district hospitals, polyclinics. And so to sink in 138 million euro into one facility, no wonder a lot of leaders ran away. But President Akufo-Addo believes that Ghana as a country must always take courageous steps for the future generation. And that's why I can't wait for the day that this ultramodern facility will be commissioned in Komfo-Anokye.
In addition to the maternity block, the government has constructed new hospitals across the Ashanti region, addressing gaps in healthcare accessibility and quality.
When you visit some of these facilities, you see that these are hospitals. For example, you be to Fomena and then you be to Kumewu. You almost have every gadget that as a doctor, as a nurse, as a pharmacist. These are facilities that we dream of working, and therefore, for that reason, people travel out for job satisfaction. They are there.
The Adansi North District Hospital in Fomena and Kumewu hospitals, with a combined capacity of 240 beds, feature OPDs, accident and emergency units, imaging rooms, staff accommodation, and many relevant units for a modern hospital. Meanwhile, the Obuasi Trauma Hospital will cater to emergency and trauma care in this underserved area. The Sewa Treatment Center offers specialized treatment services, modern laboratories, and essential medical equipment, backed by a robust 150 kVA generator for uninterrupted service delivery. Smaller facilities like the 40-bed Swami Municipal Hospital and Tridia Government Hospital are expected to make significant impact by bringing quality healthcare closer to the communities.
Say na no kasa da o de call aban mu ma o timi ekopre ya saa de natimi aba ye da saa MP na se say ye chi mensan say ye MP kro no ye de ye da na se ene ye mampanin so waboa ye bebre eniema bebre na oba aban mu waye de amaye ye de ehia ne se wo beba wo be ye niema pa aboa ye ne awofo no nti ye da na se ye da mampanin so ase say wadwene ye ho say wo say wo ma hospital ba ye nso ye mantem
sisi anso kwa yetimi asisi stores ahyehyehye ye dan mu a nyame ya adom na obibia ebetimi atonto pampesa ye ne aye nya adwuma mpo ebetimi anya adwuma
Nyankopon hata suru we nhira no oma na adwumpa ene wodo ne tema ene akokoduro a odidi oman no so a ama hospital aba no manya ye de eni enim se bi beba tie da na se ye ne no aneko.
Most of the hospitals that we were having in Ashanti region were basically not purposely built hospitals. They were health posts and then they were transformed into health centers, and then you add some makeshift and then it to become a hospital. And so we used to joke that, look, all these facilities are glorified health centers, the district hospital, and lo and behold, I came about 2 months ago and I'm seeing entirely new picture.
Yamisra wo mu say omode sa adwuma de ewe aba atwuma twede ama yeso ye wo ha no yeso ye ni beje ho se entimi mfiri ye manso nkobi manso hospital ne yeso ye nya bi ewo ye kurom nti ye be kan se nyame na nhira wo mu
be first ne ye kon carry hospital nyame adom akufo ado abaye we ama ye wa ha na we de aben ye ma mo ton aduane betimi aton aduane wo mo bi wo betimi abie kofo bie pharmacy wa ha ti pharmacy na wa no say hospital kase bia ni ha be na obi aton aduro to ho aduro no be say eno so benya nyuma kakra ma mo so obi aton aduro bia no betimi ayere akoso
aso kama na wo hwe na ina ebe krom anso a ye di dwa kra beto so be ya dia oba na kom do ba beto aduane edi ye benya va so be bile fresh bo ba bile so ba ya le a say ye ba ya le a betimi akasa koji ana ko centreso ezi we kwa no a be boa kansa no timi akoji seji kwa ko ye seji bibia o ma e be boa be.
You look at the Sechekumawu facility, because of the equipment and what we have, we are even going to add 4 intensive care unit beds because we already have the facility, which we are going to add for that to add up to Konfanochi. So you can imagine that, look, if we have a challenge with the critical cases, these are places, other places that you can also go.
In Obuasi, the government has rehabilitated the health center there to significantly improve the quality of service delivery. In Sabronum, the new 40-bed hospital equipped with state-of-the-art facilities has sparked a wave of excitement among residents.
Obeye Japade ntese am emuna basene nyende bebo empuntu efuse ha okura no a we say eyeyiro nipa se de nipa si rush ho no enya sinkuma ntese nyankopo aya aduma yenya papa ntese yenya fefe ntese nyese ka nipa nge bebuso buso ni nkura se bebuso aya ade nyankopo nhira no ma onye yi nche mo mfa mo aye ne aba nsan koso
eni age betima abo mo kora ma sika sam kora no bo ha no oni sika na ne wodi hwi wo tra fa fam moto kora ho betima fa ade na kọ so ho na sika sam kora no so ade afirim.
When you go to Mansun Kwanta, another 40-bed facility stands as proof of government's commitment to accessible healthcare. The developments continue with the establishment of additional hospitals at Jobonso and Setre Afram Plains. These facilities are designed to meet the highest standards of medical care, featuring modern amenities and specialized services that cater to the diverse health needs of the communities they serve.
We have put in some mechanism for almost every project we execute. We have a minimum of 3 years maintenance agreement that is factored as part of the project. So that once the project begins to run, you hand over the project and it has to run for about 3 years. In the case of the equipment, there's what we call a mandatory warranty, 12 months mandatory warranty. That is part of the project. But aside that, we also try and build in that 3-year maintenance period so that we can be able to maintain the project along the line. As part of our capital investment infrastructure structure that we're going to launch out soon, we've also indicated that institutions are supposed to set up a maintenance fund dedicated towards the maintenance of these facilities. Once you maintain the facility, you'll be able to realize the full realization of the project, even look at the fact that you can expand the lifespan of this project. So moving forward, maintenance culture is something that we want our institution to really inculcate so that at the end of the day, they can provide a more efficient, a more robust health system.
The government's investment in healthcare infrastructure is also creating job opportunities for health personnel and associated industries, shifting the narrative from unemployment to progress.
The Ashanti region is expected to have about 2,000 beds added to their health infrastructure capacity. Mr. President, if you add those on Agenda 111 list for the Ashanti region, you are looking at close to 3,000 beds addition within an 8-year period. Mr. President, certainly history will remember you not only as the education president, but also as a health president.
Fellow Ghanaians, in conclusion, I want to assure you once again of our vow to delivering on our promises. I'm very grateful to the contractors, the Ministry of Health, the Ghana Health Service, Friends of Ghana, funders, and all stakeholders who have contributed resources and worked tirelessly to complete this hospital.
These projects are not just investment in infrastructure, they are investment in the health, dignity, and future of the Ashanti region and Ghana. The government's commitment to transforming healthcare here is unmatched, countering the rhetoric of nothing done, with results that speak for themselves.